Hi everyone and welcome back to Cracking Up Conversations with Chiropractors. My name's Laura Rigby. This is Francesca Ellison-Lewis and we have a sports therapist now with us as well, so Raddy Bickler. Today we're going to talk about headaches, whether that's the dull headache that you get at the end of the day or a massive migraine that wipes you out for hours if not days. We're going to be looking into all of that and digging deep on what causes them. It's important to remember that not all headaches are the same and we want to make sure that you understand the headache better and that will help you to help yourself. So why we get headaches, there's lots of different reasons why you can get headaches. And you've got to remember that a headache is a symptom of something that's going on. It is not really the problem. So you've got to listen to your body. And in understanding the reason what's giving you the headache in the first place will help you to then remove the headache and any other symptoms that you're getting as well. There are lots of different reasons that we can get headaches. So we could have muscle tension, which is why we've got Raddy here as well. Nerve irritation, dehydration, I think that's a big one that people are really becoming aware of now. Poor posture, this is why chiropractors are talking about it. Stress, hormonal, even sinus pressure. Some headaches are mechanical and chiropractic can help and others aren't, and we want to be able to differentiate that so you know who to go to and where to go if you suffer from headaches. So let's get on with it then, guys. So there's about 5 different really common headaches.
Common headaches that we see in clinic, especially. I don't know if you probably see headaches as well.
Oh, absolutely,
or
yeah, all the
sporting
time.
athletes as well.
So let's break them down then. So give us the different types of headaches then, Francesca.
So we're going to start with our very typical, if you have a stressful life, job, anything, that we see is a tension type headache. This headache, we see about 9 out of 10 people. They probably don't come in with it, but I ask about headaches in general during consultations, and it's like work life, looking at a screen for too long can cause a tension type headache as well. So what does it present as? A tension type headache is where it presents as like a tight band around your head, and you can feel it as like a squeezing kind of pain. And we feel it mostly normally at the end of the day when we've done our work or kids have been screaming at us. It's there.
Yeah. Could that also be like a dehydration? And is there a difference in like what you would experience with a dehydration headache?
Absolutely. So dehydration, so not obviously, but the brain needs water. And when we don't get enough water or fluid throughout the day, our brains will not dramatically, but start to shrink a little bit, and that can cause some stress and tension going around the cranium and around the muscles as well, because our muscles need water. Everything. We are 70% water.
Yeah.
So we need water. So dehydration headache's more linked to our body needs water to function, so that's why we get the headache.
Yeah.
So it's more about that. Will go into hormones as well.
Yeah.
But for men and females, water is very essential. I know at the end of the day, if I haven't drunk water, I will feel a headache.
Yeah.
Especially.
Yeah. So then, what about migraines? How does a migraine present, and what's that about?
A migraine, I would say, is a more severe type of headache. I do see these, they're less common, and I see them more with females because they can be hormone related. I'm a migraine sufferer myself, so it's absolutely horrible if you've had one. I don't know if you guys have.
Touch wood, never had one, and that's why I want to keep it. Do you suffer with migraine?
I get them quite a lot, yeah, but I think that's more to do with my blood. I think that pretty iron deficient, so I tend to get them quite a lot.
Right, so iron deficiency can cause migraines as well. Yeah.
Again, because it's like hormonal as well, so anemia and stuff like that can cause migraines. But normally, migraines will present as a very sharp pain. Normally presents over one eye or one side of your face, and it can basically hit you out like a rock. You would be in so much pain that you won't want to look at light. So sensitivity. Thank you. Sensitivity is one of the common complaints of it. Too loud noises as well. Kind of common with a lot of headaches though, that we don't like a lot of noise though, or it can disrupt a headache.
Yeah.
But with migraines, it's more bright lights, loud noises, and in general you feel a bit sick. So some people actually throw up when they get this type of headache. So it can be so severe over one eye that you just feel nauseous, or people throw up. I know that my best friend, she throws up when she gets them. I don't. Very different. But it's very important that if you are experiencing migraines to keep a diary, because if you're female especially, they can be hormone related. So time of the month, I've actually spoken to doctors about this, and we're more likely to get them the day before our period starts.
Right, okay.
If you suffer from migraines. There's so that's the fluctuations between all of that. If you've already seen our past podcast,
You'll know.
you'll know about the hormones. But yeah, migraines are a bit harder to sort out. Chiropractic wise, we would be able to help with any tension because you get a lot of neck stiffness. I've treated some people with migraines, but I won't be able to sort out the migraine. I'll be able to help your symptoms that are revolving around it. But other to that, migraines will more likely be treated with sumatriptans and rest, get into bed,
Yeah.
knock out.
We've not just had good experience in the clinic as a whole with just chiropractic though, because Sarah, my fascia therapist, has had a really, really amazing experience with a lady who's had migraines that have put her out of action for years and years. And the work that she does is really gentle. And that's more, it is fascia work that she's doing on her as well. So not just adjusting, but working the muscles, as you've said, but also the fascia, which is incredible. So cervicogenic headaches next, starting in the neck. Do you want to tell us a little bit about that, Francesca?
Yeah, so cervicogenic headache sounds what it is basically. So it comes from the cervical muscles specifically, and this can be related from poor posture, stress in general, where we kind of get that anterior head carriage. The cervicogenic headache presents as coming from the neck, so it doesn't start in the head this time, comes from the neck and from the tight muscles, and it can present either up the neck onto the head around here. Is the typical presentation that we see. That's how we distinguish it from a tension type, which would be a band. Cervicogenic will be from the neck up.
Sometimes actually I've seen patients where it's come up through the neck and into kind of like the back of the head here, coming over that way.
So
as
it
well.
can stop anywhere, but I normally see it will maybe come over to an eye, and then you have to distinguish between, is it a migraine or is it coming from the muscles?
Cluster headache.
Or a cluster headache, but
Fun, but that's our job.
yeah.
Raddy, you must see a lot of people with cervicogenic headaches.
Yeah. Like you said, the sort of head carriage and the overall common link that we're seeing nowadays is people, especially working office jobs and stuff like that, their head tends to tilt forward, their shoulders round forward, a lot of dominant sort of muscles in their front that is causing that. And what tends to happen is they get that tension in their neck, which is what's causing that headache. And obviously as a sports therapist, we like to get in there, really try to relieve those muscles and help them be able to push their shoulders back, bring their head back, try.
Is that through rehab exercises?
Yeah, rehab exercises help, they can help strengthen the back muscles especially, and the neck muscles to help, again, like I said, pull that neck back.
Yeah.
And again, with massage as well, we can sort of relieve those muscles, ease it off, making it easier again.
It's quite a pleasant way to have a headache release.
Yeah.
Actually,
Go with that one.
I don't know if you've noticed it as well, but if you're releasing off some of the muscles, sometimes when I do it, very rarely, when I do it with someone, you press into it and they'll go, yeah, that's it.
Yeah,
and you can
straight
feel
away.
it going straight up onto
Yes.
their head and like, oh, wow, yeah,
That's
it's
the
not a
spot,
headache,
we
that's
get
a
that a
spot.
lot.
And then you'll find the referral pattern from where you're releasing off. It's quite nice,
Exactly, so,
actually.
yeah.
It's like you know what you're doing.
It's always reassuring.
It's always
isn't it?
reassuring.
And then the next one, I was going to say, hopefully we're moving away from that as we're in March, but now we're getting to hay fever season. So we're talking really like sinus headaches, that blocked nose, so go on.
Kind of
tell
like
us.
you feel groggy, like your face is heavy, your head's heavy, kind of
Makes you feel ill, doesn't it?
Makes you feel ill, and it's kind of like where we distinguish between a summer cold and is it like a sinusy, well, that's what it's called, is a sinus
Yeah,
headache, really.
Yeah. Actually, there's a few good techniques. So I did a lot of cranial chiropractic as well. So we can do some techniques to kind of unblock what we call the eustachian tube, which is where the tube moves from the ears across into the sinuses. You can get blockages there and in the ears. But just putting your hands on like your bones above your eye, so the orbit of your eye, or even here, just feeling like you're lifting up this area, can feel like you're draining. And actually, personally, with a clean hand, I'll put my finger into my mouth right here and just kind of try and release these areas along here, so along the top of like by your teeth. And that gives a lot of sinus relief as well.
Definitely.
For these types of headaches.
I think you notice it differently when it's a sinus headache. Bending forward will be a bit more painful for you, so that's how you distinguish between the
The
difference.
dripping helps. As
Yeah, the dripping, getting the nose over a steam or something.
Yeah, actually, steaming will be good
Steaming,
as well.
steaming actually does help.
Yeah. So no, doctors have said before, when you've got colds, and they said there's not a lot of the medicines actually they're not as effective as steaming, which is
Just drains it out though, doesn't it? I guess.
Just straight,
Yeah.
yeah, technically. And
Opens
it
up
feels
little
quite nice as
spaces.
well because it's warm, so it's going to make everything more elastic. Your muscles are going to appreciate, and your skin as well.
yeah, definitely.
Definitely.
Win-win then.
It's a win-win.
And then finally, cluster headaches. These are horrible headaches, I would say.
Yeah.
But go on, tell us about the cluster headaches,
So
Francesca.
a cluster headache normally presents in men, so I typically see it more with men, unfortunately. Sorry.
Well, you're too young yet.
Yeah,
you're
you're
too
too
young. Look forward to that.
Can't wait.
But this is a severe headache, so it is kind of, it will knock you out kind of headache. Going back to the migraines, this is similar. It is more like a stabbing pain going on in the head, and it will normally be around one eye. So again, similar to the migraine. However, this is more of what we call a cyclic type headache, which it will come on maybe daily, and it can go on for months, or it can go on for a month. I know that going back to uni, they always taught us, someone coming in with headaches every day, you give them a like a diary to keep it. I recommend anyone with headaches to keep a diary. But yeah, so it can come on the exact same time of day, and then go on for the same amount of hours, and then go next day, same time, and then go. But it will be a stabbing pain, and it would just be really severe, almost like kind of crying pain.
You can get like, yeah, so you said almost like crying. Your eyes can run, can you
Yeah.
can get problems with the eye. My husband used to have these, and they were absolutely awful. Actually, they came on from a very stressful period, and then left after a very stressful period. So, I think stress has got a lot to add as well with some of these problems as well.
Definitely. I think that's the difference as well between migraine and this one, is that you'll get a red eye and watery eyes, not very common with migraines. But this one, less so, needs more of a medical referral, so GP referral or urgent referral, depending how severe it is. But
Yeah.
again, we can still help with, because there'll be a lot of tension going on in the neck, and yeah, we'll be able to ease that off for you.
Yeah, but actually, you're talking about going on tension. Another thing that I see a lot, and I actually suffer with myself, is if you're a grinder or you clench a lot, because you can wake up with tight muscles around the head, and this is probably more the cervicogenic type headaches, but those types of problems. And they're all linked in the same kind of fascial plane. Going back to this fascia around here, so the top part of your neck here, if the bones are out, grinding, and a lot of people, myself included, we kind of like push back on our pillows and grinding at the same time, so you can wake up feeling really locked up here, and that is something that you just feel like you just need some release around there, and that is really, really powerful when you get that.
I think you were mentioning earlier that sometimes you wake up with like pain on one
Yeah,
side,
all
or
the
kind of
time.
like, and that can cause a headache. Well, if our pillows are wrong or we've just slept funny,
Yeah.
we're kind of like this for about 8 hours of the night, and then that's going to stress all of this tissue, and then also the facets in our neck.
Little joints in the spine.
And that will cause a headache, I can guarantee that.
But also it's going to shorten this side up as well.
Yeah, and then you'll get tightness here, and then you might notice that some people actually will kind of look at you like this, and they've got tight on one side of it. So
Yeah.
you sleep on your right, don't you?
We've had people turn up like that. I
Yeah.
can't move my head.
Can't move my head. Can't move.
It's
It's a good
completely,
sign that
like,
you're
frozen
it's locked
that
up.
side,
Yeah. Torticollis. Great for Scrabble. So there are some red flags with headaches, which is good to know. But I think it's good to have them filed at the back of your head, just in case you see anything. But also you've got to understand that they are just red flags if you see it. And it's usually very, very obvious as well. So one of the things is going to be a sudden onset headache. Well, most headaches are a sudden onset. So it doesn't mean that if you get a headache suddenly, this is what you've got. So when you listen to what we're going to discuss next, just
Take a pinch of salt, I say.
I think I was going to say pinch of salt, but I also think that's the wrong word, because you've got to take it seriously with a pinch of salt.
Yeah, with a pinch of salt. Okay. Just assess the situation, even if it's you, if it's a family, or if it's a friend, or you know someone that may be going through these symptoms. Just assess it. First thing I would do is always tell the person, go to your GP.
Yeah.
Same day referral. But again, we're going to go through them, and there is a little way that we like to remember it, and it's called Snoop, like Snoop Dogg. Snoop Doggy Dog. But so we're going to start off with S, which is systemic symptoms or conditions. So systemic, this basically means if you're suffering from a fever, any weight loss, nausea, vomiting, any of that, the first thing we'd do is I would not want to see you in a chiropractic room. I'd like you to go see your GP. This is because there could be something else going on, like virally, and those conditions I wouldn't be able to help you with. That would be sorted through medications. Again, I know we mentioned earlier, migraines can cause nausea and vomiting. Again, that's about assessing the situation if you've had these before and what's going on in general.
That's what I was going to say. You know it's your norm, then that's a bit of a different situation. But
Exactly.
Sudden onset, never had it before. Then definitely get it checked out.
Definitely get it checked out. That's more about if you feel like something's wrong and then you are vomiting, you do notice a fever as well, then that would be getting it checked out same day. Especially with a child as well, because they're more vulnerable.
Yeah, definitely. N.
Is neurological signs or symptoms. So this is any confusion. So you might, so disorientation, confusion, any dizziness as well. So that can be a sign that something is not going right with the brain, the spinal cord, or anything like that. Again, this could mean viral, and we would not be able to deal with that. We do have people walk in with dizziness, but when it's to do with a headache as well, so say sudden movements, dizziness, it would be a referral as well. But it suggests that it's to do with the central nervous system.
Yeah, and a few more serious ones as well with that. So like any numbness or seizures, double vision. The other one is as well, I think awareness is building now, but with strokes. Preceding a stroke, you can start to get a series of headaches. If you suspect someone's got a stroke, sticking your tongue out, well, not yours, theirs. I won't help.
Not at them.
And if their tongue, when they stick it out, goes off to one side and it isn't straight out, then usually that's indicating that they're having a stroke or they've had a stroke, and you need to get them not even to the GP, they need to go straight to A&E, because the sooner that's treated, the better. Speech difficulties obviously will be another one, and movement. So if they're not moving well or they're a little bit confused. My dad had a stroke at 42, and he was slurring, and it looked a bit like a Bell's palsy where the side of your face droops a wee bit. And he had no headaches beforehand, but I do have patients who've had strokes historically, and they've said, oh yeah, now I know I had some headaches beforehand. Same with heart attack. Leading up to a heart attack, often people can feel unwell in the days leading up to it, so it's the same type of things. I think just knowing this and having it in the back of your mind just helps with that awareness, and you know something might happen, keep an eye on it.
I mean, you've seen all the adverts for like when people have stroke, about what signs to watch out for, so this is kind of a great thing as well. But if you can't remember the tongue, also just ask someone to smile. If you notice that one side is droopy, doesn't come up, that's also a sign that something maybe not going right.
Could be a Bell's palsy as well.
Could be as well. But
better get it checked.
Better get it checked same day. Cool.
So
So O is sudden onset, so it means that it starts really quickly and it is very severe very quickly. So normally this we would refer instantly, because we don't like pain that starts in the head very quick.
It indicates something's going on, basically.
And we don't want
It certainly was not normal.
No.
Another O.
We like our O's. So the other O is older age. So we see older people all the time, the older generations and stuff, and they do get headaches. But it's better to distinguish what type of headache it is with the older generation. There are some types of headaches that we don't like seeing. One being if it's on this part of the head, and you notice that you can feel it's like a kind of like a pounding. And this can be a temporal kind of arteritis, which we'll go into, but it's a not very nice condition, and it's better to get it checked out. So if you notice someone who may be struggling and feel like, oh, it's really pulsating here, notice they'll say pulsating because it feels like your heart beats in your head. That would be a referral. So it's just in general that we take care of our older people, so we know what type of headache it is. They will notice themselves this isn't a normal type of headache. They might try to take themselves off to sleep because of it.
Yeah.
But it's better to understand where they are and what's going on with it.
And that's a very treatable condition as well.
Yeah,
Usually it
absolutely.
comes in with other illnesses like polyarthritis, and they're all really manageable. Although these words sound really frightening,
Yeah.
they're very, very treatable as well. So the sooner that you get somebody to the GP to get the diagnosis, the sooner they can actually be on the mend.
Absolutely.
So, I think a lot of people think chiropractic is just cracking bones and stuff. So and it's the training is really, really in depth. So this is just for headaches, for goodness sakes. We've not even got to the hip bones yet. So it's understanding that we need to, when we ask for a full and comprehensive history, we're not doing it because, well, I used to say because I'm northern and I'm nosy, but or any of us are nosy. It's so that we can get a better idea of what's going on as well, so that we can help you to help yourself. This has become very pro-chiropractic today, so let's stop. So P.
Yes, so P is a pattern change or progressive headache. So change in, so as we spoke before, like migraines, you might notice that there's a normal way for you that your migraine comes on once a month or something like that. Or you notice that at the end of the day you get a headache because you know you've been at work, you've been looking at a screen, or you've not drunk water. If you notice that there is a pattern change, like you wake up with a headache, or that the headache starts to get progressively worse and it's not normal for you, then I'd always recommend getting it checked out.
So to round up then, in terms of what to look out for headaches, we've got a worst ever headache, headaches getting worse over time, headaches with a fever, stiff neck, visual changes or disturbances, neurological symptoms like weakness, numbness and speech changes, and a new headache at 50 years old and above. So they're the kind of like top things to remember there, so write those bits down. But really, what can people do to help themselves? So I suppose if you kind of now start to understand, okay, so my headache starts here, and I've kind of got some neck stuff going on, I grind my teeth, I've got some, I need to go see a dentist and get a splint or whatever it is. Some things now that we can give you to help yourself. Raddy, in terms of cervicogenic headaches and postural stuff, have you got any kind of like quick stretches that we can, or exercises to help people help themselves?
So if you just tuck your chin into your chest, sort of doing like the chicken dance.
I haven't heard it like that before.
but yeah, even if you're more aware of just making sure to just tuck your chin in, even if you're at your office, looking down at a computer, not letting your heavy head sort of drift down, just remembering to tuck that chin in, then it can do a lot.
But also as an exercise, you can do it where you kind of just take your head back and just hold it for 10 seconds. Maybe do that 3 times every few hours if you're working at the desk. And when you're taking your head back, you don't want to be looking up, you don't want to be looking down.
No, exactly.
Or that's going to make your problems worse. So try and keep your eyes at eye level and take it back. And was the other one the wall angel?
Well, yeah, it depends what you call it. Yeah, like the wall angel, weeping angel, whatever. But yeah, it's a really good one because you can sort of do it anywhere. But yeah, you just place your back against the wall like Laura's demonstrating. And
And then you bring your arms up like here.
I think we did this in our last one as well, didn't we, with posture?
I think we might
It is
have
a good
actually.
one.
I do like that one.
But I think one, especially for cervicogenic headaches, that I always give people to do is when you sit on one hand and then you take your other hand and then just take it to the side, because you'll feel all this side stretching, and it's great after you've just been stuck at your desk and stuff and you're just like...
I do that in the morning actually, when I wake up, because my neck is so stiff. But
you need a chiropractor.
With the right people today, I think.
Yeah, great.
Also, like if you're a grinder, that one, because it just opens up all that area.
Opens up, and then you can freely move to the side and then rotate around what feels tight for you, and you start feeling it gently, and then you can actually just use that muscle to just...
I would do it a little bit different. I normally hold along the jawline and just pull a little bit, jawline and collarbone.
Okay. Like that. Oh, so that would be more front. If you want kind of more middle to back area, then go use that side.
Yeah, there's quite a few.
There is a few.
So we've got checking in on your posture, making sure that you've got the best posture. Another thing that I used to say to my patients was, certainly if you work from home, get your other half, your friends, your kids, whatever, something the kids have always got the phone on these days, is when you're in the middle of your work and you're really concentrating hard, they've got to walk in stealth-like and take a picture of you, and they can then see what you really look like. It's usually something like this. Because when you go, oh, take my picture and see how my posture is, it's not even real, is it? Like, 'cause you don't want that. You want how it really looks. So, I would definitely recommend that. And obviously, if you're going into the office, just get your colleagues to do it. Certainly, if you sit next to somebody, because they can just pick up the phone, snap it quickly, and say it's done.
Should become a trend, really.
Yeah.
And people do like seeing it, don't they? It's like when we do the posture screening, people are so fascinated when they see like sort of where their neck is
But
going.
we can actually measure them as well, and then
Exactly,
they're
yeah.
interested in seeing how far forward, and then they go, "Oh, mine's
Yeah,
better than
exactly.
yours."
Yeah.
All right,
Competition is worse
competition. Yeah.
But also, what things that you don't expect come up on those types of things
Exactly,
as
yeah.
well, don't they?
Absolutely. That's where we see all your twisting and stuff, and it might be, oh, you right-handed kind of stuff.
Yeah,
left-handed.
leaning against the desk.
Yeah.
Why
Is
have I
your
got a bad
desk, is your
shoulder?
computer on that side by any
Yeah.
chance?
Yeah,
I
'cause
look
these
like this the whole
things-
time, and then you don't realise you're actually holding that muscle tight there.
Exactly.
8 hours.
Yeah, 8 hours of the day.
So we've kind of gone through neck mobility and stretches there as well. Hydration. I don't know if you've got the hint yet, but being dehydrated is a big problem. But
Very
it's not
big.
just that. If you're having treatment or massage or anything as well, the way I talk about hydration to patients, certainly if you're a meat eater, is if you've ever had a lamb shank and you get the bits of the lamb, it's kind of got that slimy bit over it, and you cut into it and you've got the strands of meat. That bit over it's called your fascia. And if you dehydrate it, all that fascia starts to kind of, in my own mind, I'm quite a visual person, is it all shrivels up. So I imagine my muscles and my brain drying up like a prune and going all contorted. And if I can imagine something like that going on in my head, I'm like, oh my God, that's going on in my body because I've got a wee headache, then I'm drinking
Down in
water.
some water, yeah.
You're not you when you don't drink.
Exactly. Sleep hygiene.
Yeah.
That sounds a bit weird. Like if you cleaned your teeth and taken your makeup off before bed, why should that affect you having a headache?
No, but that would be more to do with kind of like sleeping posture. I know we've gone through sleep posture so many times now, but especially with your neck, I think because we're on headaches, might as well. If you've ever woken up with a headache, but more of like, not a severe headache, but oh, I can't move my neck, and then that causes a headache. That's probably your pillow might need to be changed, or you've just slept funny again. How we said, like oversleeping on one side, and I like to curl my hands. I'm a bit weird myself, so
As long as your
curl
spine's
here.
straight,
Yeah,
you
as long
end
as
up with
my spine's
arthritis in
straight.
your wrist. But the other one's stomach sleepers because they tend to go like that.
And then you're there as well, overstretching, and then tightening this side
And rotating your spine all
rotating.
night. It's terrible. Because the other thing is as well, it's like the alignment of the spine, which we've not really discussed, but like you should have 3 curves in your spine. So you should have a curve in your cervical, so your neck going towards your throat, a curve in your thoracic, so your upper back going that way, and a curve in your lower back going that way. And that is towards your belly. And the spine, these curves act as a coil so that you can absorb shock. But if you've got this forward head posture and these range shoulders through working or other things going on in your back, it stops you absorbing the shock the same, which then will increase the rate at which you're going to get arthritis or degeneration or problems in your back. And that is more long term. In the short term, what your body's saying is, I've got a headache, I've got a shoulder problem, I've got a tight neck, I need some intervention here. And that is, your body has its ways of saying what's going wrong, but usually we just pop a pill and ignore it. But it's usually better to get these things addressed at an earlier stage so that it doesn't become something bigger later on.
And that kind of leads into the next point, which is stress management.
Yes.
Big one. We always see people with headaches who go through a lot of stress, mostly through work life, I think I'd noticed, any desk workers. But there's a few things that, obviously, I can't tell you to stop working as much as we'd love to.
Run off into the sunset and do yoga.
Yeah, but absolutely, every day. But there's a few things you can change that can help, especially. So again, like we've taught the stretches and doing that at work, just changing your posture, changing your scenery as well can make you feel better as well. If you can go outside, look at the green grass and everyone enjoying the sun while you're at work, might make you feel
worse actually.
But change of scenery will help. Breath work will help as well with headaches and stress specifically, because when we're stressed we get really tight and tense, and then all our muscles and our posture changes, and then who knows, like this.
So we get a lot of women present with headaches and things.
Yeah, we're up here.
Generally, not
I'm not stressed. Are you sure?
Don't touch me.
I'm not stressed. No.
So, Raddy,
Yeah.
how does massage help? I mean, we've discussed kind of like the tight muscles and things, but how does it work for headache people then, given that you're new to the team,
Yeah.
and people will want to know, you know, it's not because you do sports therapy as well as massage. So what do you bring to the table
Yeah.
for these headaches?
Well, I recently actually got taught a funny analogy of seeing massage. So I find it quite simple and people understand it. So if you sort of imagine massage as sort of helping to get wax out your muscles. So you got fibers in your muscles,
Yeah,
and obviously when we massage it, we're getting blood to those muscles and trying to get out all the rubbish stuff like lactic acid and any other sort of toxins that may be in there.
yeah,
And if you view these as sort of like clusters of wax, sort of conjoining together, and the bigger the wax gets, the tighter the muscle is.
yeah,
And yeah, so what we do with massage is sort of burning that wax, you know, oozing it out of your muscles slowly.
yeah.
And obviously because it's wax, it's never going to go away. So there's always going to be some left, and you might still experience some tightness, and it might come back. But what our job is to, you know, get that wax out your body, and sort of try to get that on the process of getting it out your body, which again, like you said, is hydration, making sure you drink lots of water, and that's how you eventually sort of flush out those toxins.
Right, we're just going to caveat this with you don't actually have wax in your body.
No, but think of it like the thickness.
Easy way of seeing it,
The
yeah.
reason I say that is because I used to say, imagine the layers of an onion, and we're going to peel the layers back.
Yeah,
And somebody
yeah.
once said to me, "So how many onion layers do I have?" I'm like, "No, you don't. You're not an onion.
No, you're not an onion. You don't have wax.
You're not a candlestick either."
But yeah, it's just an easy way of seeing it, really. It's like the bigger the wax, the tighter the knot is essentially in that muscle.
Yeah.
So then, moving forwards, then you're going to massage, hydration, and then you can rehab somebody who potentially with postural issues. With,
Again, like we said with those exercises, really, I mean, those were very basic, but we'd have a look at you, see what headaches you get, see where you're tight, what's the problem. But then, yeah, we can sort of rehab, find the exercises that work for you, keep them.
Because everyone's
updated.
different.
Exactly, yeah.
All different headaches as
yeah.
well. So.
I suppose if you're not removing the cause, which I mean, if you look at these, a lot of the cause is lifestyle, and if you can't change your lifestyle, like I said, run off into the sunset and do yoga, they are going to eventually keep coming back as the
Exactly,
tension
yeah.
builds up again. So it's a way of managing that.
And that's kind of what we're here for.
Yeah.
It's like wellness. So we're here to make sure that the wax doesn't build up and that the candle wax doesn't stay straight. You know,
Yeah.
just
And the bones are in
the
alignment.
bones are in alignment and it can help.
And I will just add to that, I think the main thing that stops sort of stress as well, I think being educated on the different types of headaches. So if someone does watch this video, I think they will get a better insight on the types of headaches that they may be
And
sort of
be
experience.
reassured.
Exactly, yeah. Instead of
yeah.
stressing about what sort of pain they're going through and what it is.
That's a really good point.
Yeah.
Because actually not knowing what's going on sometimes is worse than the problem
Causes
itself.
more stress, exactly, yeah.
But
Yeah.
also, I think to understand that headaches aren't supposed to be in your body. A lot of us have headaches,
But
but
it's normal.
it's not normal.
Get one every day.
Yeah.
No. And there are ways to fix this, and that's what we're trying to educate people on.
Yeah, yeah. And it's not scary. They can be sorted.
They can be. I know we might have scared you with Snoop, but that's just the backup in the back of your head.
Anything else that we want to cover?
I think that's good.
Yeah.
All right, guys. Thanks for listening. If you made it this far, we'll see you next month.
Thank
Have a
you.
good one.
See you
Bye.
later.